And like literally his symptoms have gotten this bad because I couldn't get anybody to treat him.
Hello, long time no see. I'm Dr. Chris from the 100X Vet, and today we're going to talk about Bandit. You know, Bandit's people reached out to see if we can help. So let's listen to Bandit's mama and see what she's got to say to see if we can help her.
I made a promise to my dad when he got sick. It's strange, and this is where the waterworks are gonna start. And literally one of the first, he's like, take care of your mom and make sure to take care of the dog. But it showed how much he meant to him.
Well, I don't know about you, but I think we should help her, right? One of the hallmarks of a really good vet and vet team is you've got to care about people as much as you care about pets. It's a relationship. I mean, that's what we say here. We treat relationships. And so let's find out more about this situation.
A lot of the groomers there were saying that he will have to be sedated or something to move forward with grooming because he just wouldn't let them touch his paws and cut his nails and stuff. So when we came here after my dad's passing and we're like, okay, we needed to find a groomer. Because of COVID and stuff, there were a lot of groomers were not taking new patients. One, she couldn't even, she just called right after, like, and it's like, I'm sorry, like he's too aggressive, like he's snapping, I can't groom.
So that's pretty normal for us. We hear about that all the time because we see pets from, Zen, Buddha, chill, all the way to fear, anxiety, stress. The world has shown them, or genetically they've come to the table with things that predispose them to feeling this way. And so what do? Well, we've got a lot of knowledge and science and experience and empathy, and we care about people and we care about pets, and you put that all together and we implement. So let's see if we can implement for Bandit. Let's find out more.
He has a heart murmur, so they couldn't fully sedate him, so they were sedating as we progress. They were able to clean out the ears, but not like the brown stuff, like around, I guess, the inside of the ear. And then they couldn't finish the grooming. And then so now I'm like, okay, so what do I do? Because he's half groomed. His eye was starting to get infected, and then at the end of it, they weren't comfortable of doing it because of the heart. They weren't comfortable with the sedation and treating him, and then I was just kind of losing out hope, and that's when I was trying to seek out other vets that, again, could help.
So that is normal for us too. You're here to fix a problem, but lo and behold, there's another problem that presents some sort of challenge along the way. You know what we call that? Life. And what that means is we just flow with it. Life. There's problems that come our way, and who are we as people? Well, I know for all of us at the 100X Vet crew, we embody challenges just mean growth. And so what can we do together as a team working for Bandit to grow? What techniques can we bring to the table? How can we make it more comfortable? How can we creatively problem solve and use this problem, this heart issue, as not the issue, but as something that actually shows us the way to help him? How do we think about that? What's the philosophy? These are all the things that we actually have time to think about as mobile vets. This is what we do at the 100X Vet.
I'm just a fighter myself, I guess. I don't like giving up. I'm just so grateful that you listened, you're willing to help, and at least we'll know that we did everything we could, and that's life sometimes, right? But at least, we would have tried.
All right, I think we're all on the same page. I think we're gonna try. And what's the first thing that we do when we walk in to try to help Bandit? The answer is nothing. For any pet who's got any history of fear, anxiety, stress, there was some difficulty in how things went, they've got we read the records, they've got some reputation or whatever it is. We just do nothing. We clear the slate, clean slate. And we walk in and we just see what Bandit has to say. And we're watching and we're observing very quietly. We're talking with the pet parents. We're kind of like trying to be as normal and non-medical as possible. We're guests, we're friends, we've just come over. And what are we looking for? Well, I want to know, the science part of the brain Well, how long does it take his cortisol, epinephrine, all the stress hormones to reduce in the bloodstream? And so can he show me some behavioral flexibility as a result? Can he show me that I'll take a treat? I will eventually get curious about what's going on. I'll show myself, my true self. So with Bandit, we started to see these things, and all of a sudden, I could go to the next step. I heard about his heart. I want to listen to his heart. How do I do that in a way that isn't stressful for him? Well, I've got Mama right there, and he's in his own home. And we did this pickup technique, which is literally we just picked him up. That works for some pets. We call this type of appointment a two-parter. It's very effective. On the first part, it looks like we don't do much. We don't do all the things you might do in a normal exam. Because the key thing, the key win, is something I learned through studying paradise fish, actually, in the research. And what is it? It's pre-exposure. If I can get that first exposure right for Bandit with us emotionally, it means later on down the line, if we gotta give medication, we gotta groom, we gotta do something that he may not like, he's always got the possibility of pairing it back to his initial positive responses with us. Versus, if the first day is bad, he only knows that it's gonna be bad, even in the future. I have more behavioral flexibility working with him the less that I do. Just the core, just what I need, but keep it reasonable. All right, we gotta talk about this. All right, see this? I can do my face. You know, as a vet, I can clip and clean, maybe clip to put in a catheter. But really, if I was gonna do grooming, this poor dog or cat would look like it had a bowl cut. So you need a professional. You need someone who really knows what they're doing and can coordinate with a vet. Hence, the 100X Vet Mobile Grooming.
Hi, I'm Andrea, and I'm the 100X Vet Mobile Groomer.
What would you rather be doing right now, rather than being on camera?
I'd rather be grooming a dog. It's humanity over vanity, you know? Comfort groom is where we just make them comfortable. It's not about making them look pretty. For a comfort groom, you're not going to be doing any dematting or anything like that. Their coat is in such severe condition that you just want to take it off and start from scratch. Otherwise, you're just going to cause more pain, and that's not what we're about.
Our first challenge is sedation. So, because we've worked with him before on a different day, we've established a routine for him. We've got treats up front, Mama picking him up, I'm coming from the back, and that needle is going straight into the muscle. Check out what he does. What he does is nothing. This is that power of this two-part approach and that pre-exposure, positive conditioning. It's awesome. Now, we're gonna watch in a relative real time. I'll speed up the camera a little bit so you can see the progression of the sedation, and every single thing he's doing is according to plan. Now, I know he's got a major heart murmur. Now, am I worried about his heart murmur? And here's the thing anyone would need to know before doing sedation on a dog like Bandit. A heart murmur is not synonymous with a diseased heart that can't tolerate sedation. Those are two different things. Murmur doesn't mean I can't safely work with them like any other dog. I just need to customize what I'm doing and ensure that the monitoring and the safeguards are in place. It's one of those things where it's about communication. It's about quality of life. If this is a calculated judgment call that's going to lead to a better quality of life for him, then it kind of weighs out that this is what we should do. I really do expect things to go well. Part of the reason is that we're in Bandit's home. All the familiar smells are there, his people are there, and it's like friends coming over. It feels different. There's less stress, less fight or flight. This can only help the body when there are challenges, like sedation.
There's no point in bathing and drying a coat that you're just going to take off anyway. It's just going to add more time. Yeah, definitely common to see their face usually be the worst part of them, a lot of dogs don't like having their face groomed in the first place. So if they're extra fearful, there's no way that you're going to be able to clean up that face. His face was really matted, and you can tell how much better they feel, you know, once you've groomed them. You see a change in their behavior.
So for recovery, they're sound sensitive. And that means we use their names or their nicknames. Then we put their body through like some gentle passive range of motion, and voila, up they go. Even if they're not sure what's just happened, they feel secure. And there it is for Bandit, a comfort groom. It went from the impossible, things not happening for him, to simply knowing their emotions, knowing how to implement the medical science, having a compassionate groomer on board, and being in the home. Until next time, I'm Dr. Chris from the 100X Vet.